Welcome everyone to another episode of CocoMed Case Talk. Today we're going to discuss about pediatric pharyngitis, very common problem. If there's something that I want you guys to get out of this discussion is very simple. I want you guys to know when to give antibiotics to this situation because this is a very common complaint. Uh, Kids going around this season of the year complain of sore throat. It could be the flu, could be stuff. Oh, someone just joined. Let me let her in real quick. One, I think. So again, if something that I want you got to get out of this is to know when to give antibiotics. Well, what kind of antibiotic we will not discuss today. We just discussed the different presentation between viral and bacterial pharyngitis. So before that, let me ask you guys a common question. What's the most common cause of sore throat in pediatric bacteria wise? What's the most common bacteria that cause sore throat?
The
You guys hear
Streptococcal
me?
Pharyngitis.
Huh?
Oh, well,
What's the most common bacteria that cause sore throat?
Streptococcal pyogenes, right?
Okay. We usually call that Group A Streps for short. Okay. Well, the main purpose is to for you guys to recognize, hey, the bacterial presentation totally look different than the viral presentation. Okay. All right. Let's start with case number one. Vâng, as always, can you read it for me?
Yeah, sure. The case number one, 5
Right.
year old male comes to your pediatric clinic with strep complaint of short throat. This has been going on for 3 days. Patient denies and cough, chorea, chorea, hoarseness, diarrhea, nausea, wheezing, shortness of breath, or vomiting. Patient's mom reported that he has been having fever of 101.5. Uh, yeah.
Mm-hmm.
Physical exam reveals erythematous tonsils with exuded, no uvular deviation, no vesicles, and anterior cervical lymphadenopathy. What is your next best step in management? A. Supportive care only. B. Rapid antigen test and supportive care. C. Rapid antigen test and antibiotics. D. Antibiotics only.
So let's again sign and symptoms. So let's discuss the signs and symptoms. So, what's the symptom that a patient has? Sore throat, of course. That's what they come in with, right? What else that tell you, screaming at you, that you need to be concerned with? First of all, for pediatric, I want you guys to pay attention to those very dangerous symptoms, uh, like wheezing. Okay,
Mm,
wheezing is dangerous nowadays, especially with COVID.
yeah.
Shortness of breath, be sure to rule those out because the first thing you want to rule out is this kid sick enough to go to the emergency room or you can manage it inpatient. So, do you think this kid should go to the emergency room right now? No, not really, right? Because 101.5 Fahrenheit is not really that high fever. Plus, it's 5 years old. Now it's 101.5, less than less than 1 year old, then I will send it to the ER because any fever that high in the less than 1 year usually a concern. Okay, well at least for me, I'm concerning. So what? Patient only got sore throat, fever. What else? What's a physical exam shows?
The physical examination, so erythematous with exudate.
Okay, what does that mean?
It means that he have a vaginitis.
Well, not
Mm,
really. Sometimes it could be abscess in there, like
uh,
erythematous tonsil with exudates could mean a lot of things. But definitely, yeah, it's point toward kind of pharyngitis, sore throat, fever, exudate. Okay, what else? Is there any concerning like that you should concern about? No, right? Not really. This is a very typical presentation. So, what's your differential?
differential.
Yeah, I
Uh,
mean, what's your differential diagnosis? What's on your list? What do you think the patient has?
the patient have some infection in the upper respiratory tract.
So, infection in the upper respiratory, right?
Yeah.
Good, good. What else? What can be? What is the culprit? What do you think?
Sorry,
What is the culprit?
the culprit.
Yes. What's responsible for this patient infections? Is that infect? Well, we already know that it's infectious because you told me it's infectious. So now I want to know: do
We
you
we
think is
need
it
to we need to differentiate between the viral infection and the bacterial infection because we have totally different treatment for due to the cause of the infection.
exactly? Okay, we want to know if it's viral or bacterial. So, what do you think we should do? What's the best next steps? Vâng, are you still there? Wait a minute. Vâng, are you still there?
Yeah, I'm still there, but I think I have some problem with the connection. So
Okay. You want us to wait, or you want
mm-hmm.
we can wait for you?
What did you say?
We can wait for you.
No, I'm still here, but
Can
when
you hear? Can you hear and see us? That's all I'm concerned about.
I'm sorry, I have some trouble hearing.
Can you still hear and see us?
I'm still here.
Okay. When you hear me?
Yeah,
Okay. Vâng, you hear me, right?
Yeah.
Okay. Some reason it's end up with us three again, so which is fine, I guess.
Um,
So this is infectious cause, and we have to distinguish between viral or bacterial, okay? Because totally different management. All right, so what you guys gonna do? What's your answers? What do you think it is?
this patient we need to use the modified sensors or classifications to differentiate whether it is the group A streptococcal infections or not.
Good. You guys know about center criteria, which is nice, which is bring me to my next slide. So according to Centaur criteria, how many points does this patient has? Let's see. Age less than 5, that's 1 point. Absence of cough, that's 2.
Yeah,
Temperature more than 38 degrees, which is technically 101.5 more than 38 degrees, I think.
it is 38.7 degrees
Yeah.
Celsius.
So, yeah, let's count that. 3. Tender and typical cervical adenopathy, that's 4. So patient also have that. And tonsillar exudate, that's 5. So patient have more than 4 points.
Yeah.
Well, according to this criteria, the answer is just go ahead and give antibiotics. Okay, no need to do a test. Okay.
Yeah.
However, that's the answer on the test. Okay. In real life, we want to culture this. Okay.
But we still we give the
Yeah,
patient
we still give the antibiotics anyway, regardless of the test. So
and
because the test does not change your management, I won't bother swap that kid because it will put him in this miserable state. Okay. My teacher, my preceptor usually told me if the swap does not change your management, don't do that. Okay. However, I still want the culture because I want to know what bacteria I'm treating for. Sometimes it's not strep, sometimes it's something different. Majority of the cases will be strep, but you never know. It could be some weird bacteria or resistant to whatever antibiotics that you treat. So you might want to get the culture. Okay. So
yeah.
you may swap it, get the culture, and wait for the culture to come back, but you still treat it with amoxicillin. Okay.
Mm-hmm.
Amoxicillin 500 milligrams done, waiting for the culture result to come back. If it's come back strep and it's sensitive to amoxicillin, you good. If it's come back and it's resistant to amoxicillin or something else, then you know what antibiotic to tailor to. But majority of the time is will sensitive to amoxicillin, which is fine. So the answer for this question is actually D. Okay, because patients have all 5 center criteria, which is more than 4 points. You go ahead and treat, don't need to test. Okay, treat empirically. Okay, are we clear?
Yep.
But in real life, this will not present like this. Okay, this is very, very textbook presentation. But I'll throw it out there so you guys know. Okay, sometimes patient will have cough, but it still be like streps.
Mm-hmm.
But majority of the time with cough is will not streps. And patient look really sick. Honestly, if they have strep throat, they will look sick. Okay, they usually look sick, really sick. And the viral pharyngitis look not really sick at all, with
Mm-hmm.
nausea and vomiting as well. That's the flu. Okay.
So if the patient have the symptom of cough, of dry cough, it will refer to the cause of viral infection.
You still use center criteria to see if the point is. Usually, if it's about 2 or 3 points, you will just swap it and see if it's positive. If it's negative, well, in real life, let me tell you, in real life treatments, if the patient meet the criteria, like about 3 to 4 points, I'm still gonna give antibiotic, but I will like tell the patient wait like about 4 or 5 days to see if the condition improve with supportive care with Tylenol. If not, then give antibiotics. Because usually with strep throat, the symptom will last very long.
Mm-hmm.
With viral, usually it end very early. Okay, because viral symptoms usually begin and then it lasts about 3 to 5 days and then it's end. For strep, it usually will last for a long time, like 5 to 7 days. If you don't know what's going on, you still gonna do a swab to know and then send it for culture. Okay, and if it's come back positive, you can call the patient. Hey, I think your kid has strepto, and then you can send the prescription for antibiotics, or tell them to go to the pharmacy in Vietnam and get antibiotics because it's so easy to get it in Vietnam. You can just go and get it. That's how we do it over here. We just hold a prescription. If the presentation is unclear, if it's viral or bacterial, we usually hold a prescription, tell the patient to wait, and then we also waiting for the test result to come back. And then if it's positive, we just call the patient, hey, your kid has strep. Okay. Now, the very similar presentation to strep is the virus called, well, is a condition called mononucleosis,
Yep.
which is caused by Epstein-Barr virus. Okay, and it's very very similar presentation. Okay, xin Vân read the last case. Now, when can you read the next one? Case 2.
Yes, case 2. 15 years old female patient come with the chest pain of short throat. It has been going on for 7 days. She has nausea, vomiting, cough, and diarrhea. She denies any age, wheezing, and shortness of breath. She admits having mild fever about 100 degrees Celsius, and physical exam reveals posterior cervical lymphadenopathy, minocular erythema, and with no X-ray. What is the best next step in management? A. Positive care and tell patient to avoid contact spot. B. Antibiotic treatment with no further testing. C. Rapid antigen test and antibiotic. And D. acyclovir.
Okay. All right. Vâng. Since you're not talking a lot, tell me about the sign and symptoms of this patient.
Well, in this patient, firstly, we need to notice about the dangerous side of the patient, like wheezing or shortness of breath and fever. Okay. And in this patient, she has no wheezing or shortness of breath, but she has mild fever about 100 degree of blah blah blah. And
Hi.
and other signs is I don't no 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 other symptoms is sore throat, the sharp complaint, and mm, let me see. And another important sign is the posterior cervical lymphadenopathy and
Good.
mild tonsillar
Tonsillar
erythema with no exudates.
Good. What about nausea, vomiting, cough, and diarrhea? Is that symptoms as well? That's symptoms too, right?
Oh
Okay.
yes, yeah, she has that symptom. Actually, I'm confused a bit.
No,
Yeah,
you're fine. Any, you have any question, just ask, okay?
yeah.
So technically, patient have sore throat, nausea, vomiting, cough, diarrhea. Well, that's very common. Everyone have sore throat, may have that. Fever about 100. Posterior cervical lymphadenopathy, mild tonsillar, mild tonsillar erythema with no exudate. But well, she come in and she have this. I will ask her, "Are you wheezing or shortness of breath?" Say no. Okay, good. You probably don't have COVID, which is cool. I can keep you here. COVID is crazy. Usually, I will include the vital signs, but if I'm not, that mean the patient is stable. Okay, because if
Mm.
something going on, I will include the vital signs. The purpose of this case is just tell you, hey, screaming at you is viral or bacterial. That's my main goal. Okay, is it viral or bacterial, guys? I'll get straight to the point.
Oh, unfortunately, I think it may be viral
Okay,
infection. Yeah.
What tell you is viral?
Oh, I mean, uh, the the level of fever is just mild about 100 degree, and the mild tonsillar erythema with no exudate. I think if it caused by a kind of bacterial, it must have exudate. Well, yeah.
Well, actually, mono can have exudate too, but I just don't put it in. But the exudate of mono is totally different than the exudate of group A strep. So when you go to clinics, pediatric, you will get to see it. You will get to see the exudate of mono. If you happen to see one, yeah, you totally see the difference. But let's stick with the classic presentation, okay? No exudate. Let's just say no exudate. So we can use center criteria. So patient A less than 15, well, she exactly 15. Let's just say that count as one, because criteria can be modified and changed. But I'll say it's one. Okay, no cough or cough. Okay, so we don't count that. Temperature is not really toxic, so we rule that out. Anterior, she had posterior, so we rule that out as well. No
Mm,
total exudate, so we rule that out as well. So patient only got 1 point. So according to central criteria, no further treatment is needed. No testing is needed. You can send this patient home. Okay. So what's the
yeah.
answer?
Oh, I think the answer is A. Supportive
Good.
care and top patient avoid contact spot.
Why avoid contact spot?
Mm, about the contact spot, I think that patient has suffered from a disease kind of. Oh, let me see. Maybe
Well, for
I
me,
forgot
this.
the name for the disease.
So when you know why we avoid contact spot, even
It's
though we don't know what's the culprit.
because when we participate in contact sport, we tend to infect the aspiration
Okay,
bacteria.
good. Well, yeah, that's kind of the thing. But there's one thing that I'm worried about is we don't know if this patient have mono or not. And if the
Mhm.
patient have mono, they will have enlarged spleen. It may not present. You may not be able to feel it, but you may be able to feel it. Enlarged spleen means that it can rupture if you involve in contact sport. So because I'm not sure if this patient have mono, what I'm doing in my clinic is I will swab her throat and send it to see if it's mono or not. I'm still convince her to, hey, do not involve in contact sport for at least 7 days or until you feel better or 2 weeks. Because what if she have mono and we miss it because we're gonna send her home anyway without any testing or any treatment. What if she got mono? Um, if she got mono and she involved in contact sport, she will have a risk of rupture her spleen and she will bleed to death. Okay, so that's why we avoid contact sport because we don't want that to happen. Okay,
Yeah.
for me at least, for my management, I will send her home. We may not swap her. We may, depending on the physician. I will tell her to, hey, stay at home for at least 2 weeks until you feel better. Okay. Or you can go to school, but don't play sports. Wear mask. Okay. Don't want to infect anybody. Don't go and kiss anybody. Don't go and kiss any boys. Mono transmitted by saliva. By the way. So see, transmitted by saliva. We usually call kissing disease, fever, malaise. This is the exudate of the the mono. See, mono also have exudate, so you really be careful. Sometimes it's have exudate. So I guess the main point is whenever it's fall into the red line, which is like 2 to 3 points, we don't really know what to do. We're just gonna go ahead and swab. Okay, if the test is positive, go ahead and treat because definitely strep. If it's not positive, okay, you want to do a throat culture. Okay, because this test sometimes it can be false negative. Okay, and I see many of that. So if it's negative, what you're gonna do is, if you in doubt, like I mentioned earlier, if you in doubt and the patient look really toxic, look very sick, go ahead and give antibiotic, but what also wait for the test for the throat culture to come back. If the patient look not toxic and look like he or she can tolerate it for a few days while we're waiting for the result, you can go ahead and send the patient home with like Tylenol or acetaminophen for fever, pain, stuff like that. Okay, and wait for the throat culture to come back. If this come back positive, call in the antibiotics. Okay, if it's not, you're good because definitely nowadays I see we use too much antibiotics anyway. It's just like you look sick, here's antibiotics, take it for a few days, feel better. Oh, that's bad.